And for the next story, let's shift our focus to Botswana. The diamond-rich southern African country has declared a public health emergency. The country's supply chain has failed and hospitals have run out of medicines. President Duma Boko has made the announcement in a televised address on Monday.
By the powers vested in me by Section 17, subsection 1 of the Constitution of this Republic, I hereby declare a state of public health emergency, granting me the necessary powers to make decisions quickly to address the immediate medical needs of the nation.
He also announced over $18 million in emergency funding to restock clinics and hospitals. The president said that the military would oversee the drug distribution.
The purpose of the fund is to facilitate strategic procurement of healthcare supplies to adequately support the public health system's needs, to align procurement activities with the Ministry of Health's comprehensive plan to ensure timely delivery of medicines, consumables, hospital machinery, and spare parts.
Earlier this month, Botswana's health ministry warned that the system was severely strained with $75 million owed to private health facilities and suppliers. The ministry cited shortages of medicines for hypertension, cancer, diabetes, tuberculosis, asthma, mental and sexual health. Elective surgeries have also been postponed. Now, the diamond-rich African nation has relied heavily on mining to fuel its economy. Botswana's vast diamond reserves were discovered just after independence from Britain in 1966 and make up about 80% of the country's foreign earnings. But sales have weakened in recent years, pushing the cash-strapped government to suspend certain ministerial purchases last month. Depleted government coffers have triggered a public health crisis in Botswana, and steep cuts in U.S. aid have further exacerbated the situation. Before the Trump administration announced the cuts, the United States funded a third of Botswana's HIV response. Washington also provided $12 million through the Global Fund to fight malaria and tuberculosis. A downturn in the international diamond market and steep U.S. aid cuts under President Trump have hit Botswana hard. Most of the country's 2.5 million people are grappling with unemployment and high poverty rates, and now the country is reeling under a national health emergency. Now, before taking office, President Boko has said that his main focus would be to fix an economy too reliant on diamonds. But looking at the current state of affairs, it seems that Botswana has a long way to go before achieving this goal.
Firstpost now available in 9 languages on YouTube. English,
Stands at $36 trillion.
French,
Le FMI, comme
German,
Geschäftsführenden Direktor
Hindi,
$30 trillion kakarjo.
Indonesian,
Pemerintah tanpa pemeriksaan.
Italian,
Sekali radikali.
Japanese,
4 兆ドル以上も
Portuguese,
por causa do próprio balanço patrimonial.
Spanish.
Beautiful bill.
Go to Settings, click on Audio Track and select a language of your choice. Be the first to know what's happening around you in your first language. Firstpost.